out. But see, the thing of it is, there's a way you can get free. This is called the hidden addiction and how to get free. And we make sure we've got to get into that too, because just to tell you that sugar is an addiction and then leave you hanging in the air really is not a good answer. Okay? Again, about sugar, the basic addiction, all sugar products, white flour products, including pasta, junk food in general is included in this category. And I call the three white deaths: white sugar, white flour, and salt.
White sugar,
white flour,
and salt.
Right.
Are there substitutes for these that you're going to be dealing with in a moment?
Mm-hmm.
Okay.
Okay.
Wait a minute.
Well, we can talk about it now. Yeah.
Well, what are some of those substitutes?
Well, if you want to cook and leave sugar out, if you don't have Candida, if you have Candida, you can't use any sweetening agent. But unprocessed honey, that means not heated, you can get it at a health food store, was a good substitute. You can use less. White flour, use the whole wheat pastry flour. And then salt, there are salt substitutes. The herbs are just excellent to use. And
do they give us the same taste?
Well, you have to see, the thing of it is, when you're eating a lot of sugar, you don't really taste. Your taste buds are about destroyed. Same thing with smoking, about destroys your taste buds. And it takes a while to recondition yourself. But once you get sugar out of your life, and then you go try to taste it again, it tastes so sickening sweet, you wonder how you ever ate it. But then carrots take on, and once your tongue gets cleaned out, carrots, for example, take on a new sweet flavor. You wonder why they ever put brown sugar in sweet potatoes or yams, because they're so sweet naturally. But see, we're so accustomed to sweetening things that we just keep getting more and more. Okay? I'm going to skip over these myths about addiction because we're running short of time here, but because I want to get into how to get free. Okay? Because there's a lot of myths about addiction in general. It just means that we think that just the derelict laying in the street's an addict, but we very well could be an addict ourselves and not even know it. You see, but how to get free, this is what we have to show. And what do we do? Remember I said there was an underlying depression that makes you, I would eat even though my Candida's been gone for 1.5 years, and I still haven't overeating.
That brings up a good point. Mm-hmm. I've had people tell me I felt so bad that the only thing I felt like doing was going and eating.
Right.
Now you're saying that really the eating, excuse me, very well could be causing the depression.
Right, exactly. Exactly. We crave what hurts us the most. That's exactly true. And not knowing. See, our body could be craving something good for us, but we don't know what it is, and so we just keep eating and eating and eating, and it's not that. It must not be this. It must not be that. Give me some more, until you're just so stuffed and sick, that you can't.
So your body physically seeks fulfillment with food.
Right.
Like mentally, we may seek fulfillment in a vocation or in a relationship. And we keep searching maybe in many different areas, just like we do food-wise, seeking, our body is wanting satisfaction, it's not finding it.
It wants good nutrition. And it may, if your body's damaged badly enough, it may need nutritional supplements. Very likely does. Mine did. I take mega vitamins now to try to make up. And not only that, but see, a lot of the foods today are stored and processed in a way that, we need more nutritional supplements. And that will... the improvements, eating better foods, changing over to whole wheat, changing over to the good vegetables and the good fruits and all the natural things, and then taking supplementation if you have to. Education, go get a book, read it. Nobody has all the answers. It's like a deep sea. We'll never have all the answers until we die. But learn about it. You are responsible for your own health. This is how I found out. Reading and reading and reading and reading and searching for good health.
So really what we want to do today is we want to sow some seeds into the minds of people so that they can just begin to improve their own knowledge, increase their own knowledge about food. And this is what we're talking about today, is educating ourselves.
Right. That's right. And then make a commitment that you're not going to have those addictive substances. You're going to stop. You're not going to switch over and take, like I said, you go on a diet, so you stop eating sugar, start drinking coffee, and smoking cigarettes. Total abstinence. Quit eating that stuff. It just makes you want more. And like I said, avoidance of newer substitute addictions. Don't go to a different one like I've gone to speed and all those different things. And then exercise is so important, too. Take a whole other program to talk about exercise. But I'm hoping that people will write, and I can send them a bibliography of books if they can get.
And share with us your address and telephone number.
My name is Barbara Dewey, and I live at 125 South Jeffrey, Ithaca, Michigan, 48847, and I'm available to come to organizations or churches and talk about nutrition, Candida, whatever it is that people need to hear about. And I'm also a ventriloquist. I have like 30 different puppets like the Muppet Show that I do singing and entertainment, nutritional entertainment with. And I'm very anxious to help anybody that I can help, because I really believe that we're our brother's keeper, and I want to help in any way that I can, because I was sick and now I am well, and I want everybody to be well too.
Tell us what it feels like to be free of all of that.
It feels great. It feels great to find out that I wasn't really crazy, because I thought I was. At one time or another, I thought that, you know, I was mentally ill, and I really was mentally ill, because, see, whenever I'd eat something that with sugar in it, then I would act. I would yell. It was such an irritant. See, and then, see, children, we say, oh, Daddy gets a big piece of cake, and here Junior gets a big piece of cake, and poor little Junior is only a third or a quarter as big as Daddy, and here he's eating all that. And the children get squirrely. I mean, we wonder, once your eyes are open to it, and you can see, and you're in the checkout line, you know, and somebody behind you has all this junk, and they purposely put all this sugar and junk food at the checkout line, and kids are yelling, I got to have this, you know, and the mother says, oh, all right.
Sugar then is definitely a cause for hyperactivity.
Hyperactivity and additives too.
Well, listen, Barbara, thank you so much. It's been very enlightening, and I'm sure our audience has likewise been enlightened. We trust that it has challenged you to start thinking about your diet. Thank you for joining us today. Until next time, goodbye.